How we doing? Hanging in there? Okay. So if you want to take your seats, we are down to the nitty-gritty. I am so happy to introduce Michael Colling, and yay, from Residential Home Health, which has been an outstanding home care agency for people with Parkinson's for a long time. And Michael's going to go over a very good presentation about safety, mobility, and assisted devices. So I really do urge you to pay attention to this information. It's very, very important. Thank you, Michael.
Thank you. Thanks, Julia. Hi there, I am Michael Colling. I'm a physical therapist and currently working for Residential Home Health. I have worked for that company for 12 years this year, and I've been a therapist for about 40 years. I started in outpatient orthopedics and have progressed, and when I went into home care 12 years ago, that's when I really developed a big interest and a need to learn more about Parkinson's and become more adept at treating Parkinson's through exercise and the different modalities. So I am Parkinson's Wellness Recovery Certified, I am BIG certified, and I do all those modalities with my Parkinson's patients in some form or another. Today we're here and we're going to just talk a little bit about safety devices, fall prevention, and we're going to raffle off a U-step walker and a cane that U-step makes that has a laser on it. So get going here. We're going to enhance safety and mobility through the use of assistive devices. So the devices I'm going to talk about are the walker, the cane, the rolling walker, and a multi-wheeled walker, and then finally a very Parkinson-specific U-step walker, which is designed specifically for neurological disorders. Common neurological disorders: Parkinson's disease, multiple sclerosis, stroke, cerebral palsy, traumatic brain injury. All these need some sort of assistive device, if necessary, to help people stay mobile and their quality of life at their most peak that they can. The effects of these diseases on mobility are balance issues, muscle weakness, gait abnormalities, freezing episodes, which some people are familiar with in this room. The importance of assistive devices: it helps maintain your independence. It helps with fall risk, increases your confidence with moving around, and enhances your quality of life. I hear so often, oh, I don't want to use a walker, I don't want to do this, I don't want to use a cane. But if you use these assistive devices, it actually helps increase your confidence, it helps increase your mobility, it helps improve your quality of life, because then you're safer when you're moving around. So it's very important to be safe so you're not falling, because that's all we need, is to have someone fall and then have another injury on top of your Parkinson's disease. A fractured hip, a brain injury, hitting your head too hard. So these all help prevent those things. So we're going to compare a few of the devices. The U-step, the standard walker versus the rolling walker, and then of course a cane, which we have right here. A standard walker looks just like that. It's a walker that you pick up, move, take some steps forward. That's normally for something or somebody who may have had an acute injury and needs some support right then and there. But if we want to stay more mobile, the pros and cons. It's very stable, but you're moving at a very slow pace, less fluid. We want to maintain that fluidity of the walking too. A rolling walker looks like that. Multi-wheeled walker, or a walker with two wheels in front, allows you to move and still keep that fluidity, that normal gait pattern as we're walking along without having to pick it up and move it along, and still provide some support. Pros and cons for a rolling walker. Increases your mobility, like I said. There's a seat for sitting down and resting. I don't want to turn my back to you. Cons, they're less stable and they can get away from you because the rolling walker, as you get moving, sometimes can keep moving, especially with Parkinson's disease. So that's another con with the rolling walker. A U-step walker, which we have right here, if you could focus on this, Dan, is shaped differently. It's designed for neurological disorder. This model has a laser cue on it as well. So it gives you a visual cue to take a longer step to avoid that shuffling gait pattern for people who respond real well to visual cues. This U-step walker also has a metronome on it. So it allows audible cues to maintain that fluidity for walking, because you can hear that click, click, click as you're walking along and perform a more normal walking pace. Other pros for it, it's specific for a neurological problem. It has the curved frame. What makes it different from a rolling walker, you have to squeeze the handles to move. When you let go of the handles, that's when the brakes come on and it won't move. So it stops you from having that feeling of the walker's getting away from me, sort of thing. The other nice thing for this U-step is you can turn in a circle right on it. So it's 360 degrees. Whereas you had a standard walker or rolling walker, you might have to turn a little bit and have a wider area that you'd have to turn in. Clinical considerations. Make sure that you're assessed by a professional and see if this is an appropriate device for you. Training, so have a professional train you how to use it. Don't just go and say, oh, I found one on Facebook Marketplace and I'm going to get it. If you do something like that, make sure you talk to someone or a therapist that you could go in and have an assessment and show you how you could use it. And you also want to look at wear and tear for it too, especially if you're getting something that was already used. There we go. I have a short video here, it's 3 minutes, and it kind of goes over everything with the U-step walker.
Hi, I'm Dr. Steph Dorworth, physical therapist. The U-step Neuro Walker is designed to increase independence and eliminate falling.
Can you get it up on there? What is it? Alt 10. We're working. This is Danny. He is our AV man. There you go. Oh, there you go. Oh.
If feet are numb and the sensation won't go away, do this 30-second biblical.
Now we're good.
Among those with neurological conditions. The U-Step NeuroWalker's leading edge features make it superior to other walking aids by providing greater stability, maneuverability, and control. Over 100,000 people have actually benefited from the U-Step NeuroWalker design, regularly prescribed by physicians and PTs, OTs from leading hospitals and rehabilitation centers, and covered by Medicare and most major insurances. The U-Step NeuroWalker has proven to be beneficial for patients with Parkinson's disease, balance disorders, and other neurological conditions. The U-Step NeuroWalker includes several advanced features. The U-shaped base. Our patented U-shaped base is ultra stable. It surrounds you and braces you in every direction from falling. Reverse braking system. With the innovative reverse braking system, the U-Step will not roll until you lightly squeeze either handbrake. Once the handbrake is released, the U-Step stops immediately. Rolling resistance control. Unlike other rolling walkers, the resistance of the U-Step's wheels can be adjusted to set the desired walking speed. Maneuverability. By placing the main turning wheels toward the middle of the base, the U-Step turns around in 29 inches as compared to 50 or more inches for other walkers. The laser sound and cueing module. The optional laser and sound cueing module is primarily used by those with Parkinson's freezing, but can be used by anyone with an irregular gait pattern. This cueing module, with its laser and metronome, helps you get started, normalizes your walking, and increases your stride. The U-Step NeuroWalker comes in 3 models. The standard model is the primary option for those with Parkinson's disease, multiple sclerosis, and many other neuro conditions. The platform model is ideal for those with a stooped posture or a weak upper body and trunk, or have suffered a stroke or brain injury. The press-down model is ideal for those with weak or no hand strength to squeeze a standard handbrake. Medicare and most major insurances provide coverage for the U-Step NeuroWalker for those with neurological conditions or conditions causing the limited use of one hand. The U-Step NeuroWalker, giving over 100,000 people the gift of walking by increasing their independence and eliminating falling. For more information about the U-Step or how to order the U-Step for your patients, call us at 1-800-558-7837. Email us at walkers.
All right. And I got to go back to oh, it's on. Okay, very good. So here's our comparisons chart. Stability, standard walker, always the safest because it's got 4 legs on the ground. But it doesn't have a laser cue, doesn't have the braking control. The nice thing is with the braking control, if you have one weak hand and one strong hand, you can still use it either way. Both do not have to be applied at the same time. Rollator walker, it's good for stability, but doesn't have laser cue or braking control. The U-Step has all 3, so that's what's good about this one. Let's go to the next slide. I've had patients where they've used regular walkers and rollator walkers, but this is by far much safer and better for them, and they've shown much more ability to increase their quality of life, being able to move around with more efficacy and safer. Next slide. So make sure the right device, you get better outcomes. U-Step is ideal for neuro conditions. Therapy and training using the U-Step is key because they do have the laser pointer, they do have the metronome, so you want to have everything set up that's specific for your condition. Now, one of the main questions I always get is, does Medicare cover this? Yes, Medicare Part B covers up to $400. So they would pay for a standard U-Step walker where it doesn't have the laser cue and it doesn't have the audible cue, but it would have everything else. If you wanted to pay out of pocket for the other points, you could. Any questions? Yes? Up to $400. Yep. That I'm not sure. I don't work for USTEP, though it looks like I do. And I do know, working with home care and doing home care, every 5 years, Medicare will pay for a new assistive device. But if you just got a walker, they won't pay for it for 5 years. Yes?
I'm just wondering what your thoughts are about this one.
I like the upright walkers. Yeah. And they do a step up walker. Yeah. Yeah. Yes, sir.
Well, he wants to know, does the walker that you're talking about, does it, just wants to know how you can count the number of steps that he's walking? 'Cause I guess that these devices don't seem to, count the number of steps. So I'm just wondering if there's any way
Like
to
a
do that.
step counter watch or something like that?
Does it sync with any of those?
That I do not know. I don't think so. Anything else?
I'm coming.
Oh, got some more?
We're going to use the microphone so everybody can hear the questions.
Excuse me, is the height adjusted for the individual?
Yes, the height is adjusted. It can adjust through here. General rule of thumb, whenever you're adjusting any assistive device, is it should hit you at the break of the wrist, and that gives you about a 30-degree bend in the elbow.
How many degrees bent?
About a 30 bend in the
30,
elbow is what
okay.
we're taught in school, but the easiest way to do it, I just tell people, make sure it hits you at the break of the wrist, the height, and that way it's set up correctly.
Okay, and the other question I had, if someone does tend to stoop over a little bit when they're walking
Yes.
with a rollator,
Yes.
would that be better in terms of that?
Not necessarily. They still might stoop over. The best thing is to cue them and say, stand up straight. Or get the upright walker for people who tend to stoop over, like this one over here. And U-step does make an upright.
You want to comment? Any comments about walking sticks?
Yeah. Like this walking stick, or you mean?
Urban.
Oh, the urban polling?
Oh, yeah, he would
I do
love
like
to.
the urban polls. My wife is urban poll certified. And my wife is Deb, who did the YMCA.
Right there, Deb. They
And
belong to
she's
each
urban
other.
polling certified, and it's very, very good. I like how it gives you some support. It provides that rhythm. It gets that big arm swing going. It's a very good modality to use for Parkinson's. Oh, we got another commercial.
Oh.
What'd you say?
It on the sand. It was great.
Well, good.
I used the hiking sticks on the sand.
And it was great, she said. So it provides you, so not only do you have your legs that you're standing on, 2 more points of support that you're moving through to give you that support. Julia's going to get her exercise.
Yeah.
Just a comment about the urban polling is that it's really good for trunk rotation as well.
Right.
And I can actually walk longer when I'm using the poles than if it's like a regular walker or something that keeps you straight.
Absolutely. Yep. Yep. Deb brings the urban poles. These are urban poles. This is what they're talking about. I got to get in sync here. There we go. It's like anything. So it gives you support. No, Medicare will not pay for exercise equipment. They would consider this as. We do have a Rocksteady discount, I just heard.
Normally $129, but if you order through Rocksteady, they're only $77.
Oh, that's a big discount.
Can you repeat that, Michael? Because we can't hear it over here on this side of the room.
Rocksteady discount for urban polling. They're normally $129 for a pair. They're $77 through Rocksteady.
And they have cool Rocksteady logo on them, so you're like,
And they have a cool Rocksteady logo on them.
Thank you. Okay, we have a question over here.
Yes.
So with the U-Step walker, my mom currently has one, and we've noticed the wheels are like getting stuck, and it seems like there's like dirt or something in them. Do you know of a facility that we could take it in to get service, like not the brakes, but the actual wheels.
The actual wheels. I would take it into any of the durable medical equipment companies. I would call first and see if they can take care of it for you. Most of them do.
You could also call In-Step Mobility and ask them for a dealer in Michigan.
U-Step Mobility.
For
Did you say InStep?
It's the company that
is
you
it
get it
InStep?
from is called In-Step Mobility. And you could call them and ask them who a dealer is in Michigan, and they might. Benson's is not one. I can tell you that. Yes. You can also call the foundation and talk to us, and we can help you with that. Wait for me.
My wife has some of those, and they're not weight supporting.
Correct.
They'll
not
collapse if you put it.
correct. If you put too much weight through them, they'll collapse.
Right, so they're not made for.
They're just made
stability.
for balance and to provide a little bit of support.
Right.
Ours are Rocksteadies, are push pin, arthritis foundation certified.
Yeah, so ours aren't a screw tighten, they are a push button.
Yep.
And so we had a fighter fall in Florida and they're titanium steel, ours are. We don't not recommend buying them from Dunham's but ours don't have straps either. So if you fall, they won't tangle in your legs. But Tank fell in Florida and used one and got his butt up out of the sand. Now it bent, but it held his weight. And he came back with one bent and now we got a new set for him. But they're not the Titan where you're like, how one's taller than the other. It's, I'm 5'7", you put it in the 7 and that pin pops through and that holds. So that's why ours are a little bit different because they've been vetted more with Rocksteady standards. That in the art, they have springs in them so you get no vibration up through your hands either. So not that I don't get any kickback from them. I just want
You
everybody to
should.
know them. Yeah.
You should. I think someone over here. Okay.
Can you demonstrate how that folds down for transportation in the back of vehicles, please?
That is exactly one of the cons of the U-Step. It does not fold up.
No, it does.
Oh, does it?
It does. I can help. I can help. It does, actually. Here, I'll.
Is that this one here?
Nope. I'll show you. I can demo. But it
It
is
is
very
big.
big. I often say to people that if you're going to get this U-Step, which I actually think is much more sturdier, for sure, no question. But this is not the one that you want to put in the trunk to go to Applebee's, right? You want the lightweight. This is very heavy. So the way that it folds down is that, oh, wait, sorry. Let me take this off so everyone can see.
We don't need it.
Yeah. This right here is a U-Step button. You just pull it this way, lift it up, and then here it will say lift here to fold, and you lift this, and it folds down flat like this. And then there's a clip here that can keep it together,
Like a stroller.
and
Clip.
it's
Yeah.
heavy.
Yeah,
So
they're not light.
that's why I'm saying I don't usually recommend this for short travel stints, but in your home, particularly in small areas, this is very, very, very helpful. Does that help?
One back here. Way in the back.
Don't get this on video.
Do you have any recommendations for a person who has severe freezing when the visual look of the floor changes? Like, for instance, in here it goes from carpet to wood, carpet to wood.
I teach my patients when they start to freeze is to stop, take a breath, weight shift, and then take a step. The thing with the U-Step, it does provide a laser, this U-Step does, where it can give you a visual for them to take a step, which does help prevent with the freezing.
Yeah, and he has a couple of different walkers, and one is a U-Step, but just what you were just talking about for travel, he was falling, trying to get it in and out of his car.
I find the most effective thing, at least for my patients, is stop and get them weight shifting first and
Yeah.
then go.
Yeah. That's what we're doing, but
Perfect.
it's a little difficult.
I know,
Still.
I get it. Yeah.
Any other going on? Oh, here. Okay, I'm coming.
Right over here.
I think you said that cane has a laser on it?
It does.
How does that work?
It's like one of those lasers you tease your cat with, but it's right here. Right. Oh, there it is. You got to push on the ground and then it gives you the cue. Let's see if you can see it. So see the red line? And every time you push on it, it gives it's off when you take the pressure off of it. So it gives a visual cue to take a longer step over.
Any other questions? Oh, and how much is the value of that one that is the second raffle? I think it's on the ground. Is it
$245.
$245? $245.
All right.
All right. Thank you. Well, get your raffle tickets out here.
Thank you so much.
Thank you.
Thank you for staying, and you guys all have a great day.